They've got some really fantastic results. So their product is really quite a unique product. The idea is that you give their product at the beginning of a season, and it will then prevent you from being infected with flu for the whole season long. So you only need to give this once. So it's not a vaccine, but it is a preventative product. And they've got some really great top-line data. So they were looking at the number of people in the treated groups versus the placebo group who were able to be prevented from having flu. And what they managed to see is that they had a preventative efficacy of approximately 70%, which is fantastic. And they tested multiple different doses in different groups, and each of the different doses really worked really well. So they got some really great data to move forward with here. So hVIVO is really well known for doing human viral challenge studies, but this, of course, is a field trial support where we're less well known for. So since we moved into our new premises at Canary Wharf, it's really enabled us to expand our service offering and really give our clinical expertise into other types of areas. So we've got so much more space now. We've been able to use the same clinical staff that have been used to conducting challenge studies and screening thousands and thousands of people every year. And now we use that expertise to support field trials. So this is a good example of that. So we used our expertise to support Sadara in this field trial. And it was complex because it wasn't just our site services, but also it's combined with our lab services as well, because our lab had a big part to play in this trial as well. So we were the sole UK site, but this was also a global trial. So there were other sites across other countries in the world, but in the UK, hVIVO was the only site recruiting for this study. So FluCamp is our recruitment arm at hVIVO, so our volunteer recruitment arm, where we have many thousands of people on our database. So because of that, we were able to recruit very quickly for this study, which is really crucial for a product like this, because these products, which are targeting seasonal viruses, means you need to be able to recruit your volunteers, administer the product all within a really short time window, because you're trying to do this at the beginning of flu season before they become exposed to the flu. So you've got a very short time window, a matter of weeks, to recruit and dose all the volunteers. And we were able to get 817 volunteers enrolled onto this study in a really short time frame. So we're really pleased with those results, and our FluCamp recruitment arm really was pivotal in doing that. So hLab is our lab arm at hVIVO. Of course, at hVIVO, we've been conducting lab studies since our foundation in 1989. But until we moved into our Canary Wharf site, we were able to really had to minimize the contracts we offered externally because our labs were so busy supporting our challenge studies. But moving into the Canary Wharf site now, where we've got so much larger lab spaces, has really enabled us to open up that as a service offering for others. So we're now supporting many more phase 2 and phase 3 studies coming directly into the labs, and some preclinical work into the lab space as well. So it's really enabled us to use our virology and immunology expertise that hLab is really well known for, but not just support challenge studies, but support these really large phase 2, phase 3 studies. We were delighted to be able to offer that service for this trial, and they were pivotal because, of course, the primary endpoints are all based on whether you've got infected or not from PCR, and those PCR assays were conducted by our labs at hVIVO in the hLab. I'm sure Sadara, like us, are delighted to see such fantastic results in their phase 2 study. And when you get good phase 2 data like this, every company is then really keen to move their product directly into phase 3, where, of course, they get that pivotal data which is needed for market authorization. So I'm sure they'll be looking to get into phase 3 really as soon as possible with this product.